Unresolved restless leg syndrome that lingers on or progressively worsens can begin to destroy your quality of life. Many that suffer with restless leg syndrome feel trapped in a box and forced to accept common nerve and pain treatments. Well, if only these individuals knew that the gut was responsible for many of their symptoms. If this sounds familiar to you, today I'm going to give you 5 clues that your gut is responsible for restless leg syndrome and could be the direction you've been looking for. Dealing with restless leg syndrome can feel debilitating. While medications exist that can temporarily improve the presentation, almost no one wants to take them and run the risk of side effects without resolving their condition. Yet, there is a connection to restless leg syndrome that affects many with the condition but is often overlooked. It's known as SIBO, or small intestinal bacterial overgrowth. SIBO does not exactly present the same way for everyone, so today I'm going to help you by giving you 5 clues that SIBO may be a contributing factor to your restless leg syndrome. But before we do, allow me to introduce myself. I'm Dr. Arlen Hill, and I help first-time and recurrent SIBO sufferers restore their gut function by targeting all 3 phases of the condition and resolve symptoms in a timely manner. Let's get started so you can start feeling better. To start off, if you have restless leg syndrome and also have gas, bloating, distension in your abdomen, and even pain, go ahead and drop down to the description now and pick up the SIBO solution because you're guaranteed to have small intestinal bacterial overgrowth. But if your symptoms are not quite that obvious, let's dig deeper and see if your body is giving you some clues that are going unrecognized that could be signaling that SIBO is the direction you need to focus. Number 1 on our list is going to be that you have unrelenting fatigue that does not respond to iron. Now, why do I say does not respond to iron? Well, many individuals recognize that restless leg syndrome is associated with iron deficiency. And a lot of times we suggest that when you're fatigued, you may have anemia, and that anemia can be corrected with iron. But here's the problem with that, is that many individuals that have had a blood count or a blood test that look for anemia don't recognize that B vitamins can also have an influence on whether or not you're having fatigue. In fact, in many individuals, they may be more significant even than the iron. Small intestinal bacterial overgrowth is notorious for creating B vitamin deficiencies. So if your fatigue has continued on and you know you even have an anemia and you've tried iron and it's not being successful, you're not seeing any improvement in the way you feel, chances are you've developed some B vitamin deficiencies, and those could be as a result of small intestinal bacterial overgrowth. Number 2 on my list is going to be that you have indigestion and reflux. Now, what does indigestion and reflux possibly have to do with restless leg syndrome? Well, the connection here is through an organism known as H. pylori. And this is a bacteria that can infect the stomach. And interestingly, H. pylori has a direct link to restless leg syndrome also. And it does it through a couple of different ways. It can release different inflammatory factors that can irritate the nerves and make the pain sensation in the nerves that we look at as restless leg syndrome more prevalent. It can also contribute to an iron deficiency, and equally, it can create a B12 deficiency. So you're seeing a theme with these B vitamins start to pop up. And in addition to that, H. pylori, again, this bacteria that we find in the stomach that can be infectious, can also set the stage for, you guessed it, small intestinal bacterial overgrowth. So any indigestion and reflux needs to be looked at deeper, especially if you've been trying to treat that for a while and you have restless leg syndrome. Chances are there's a connection there you need to be thinking about and looking deeper into. Number 3 on my list is going to be that your bowel motility is inconsistent. Loose stools sometimes, and maybe even to the point of being diarrhea, and then maybe you switch back over to constipation. There's just inconsistency in your stools. Well, this is often as a result of changes in the bacteria in your gut. it's a pretty strong indication that they're not balanced. In fact, contrary to what we often think about as being associated with constipation, some will often say you need more fiber, you need some magnesium. Well, in fact, a lot of times constipation is related to an imbalance of bacteria in the gut and changes to the nervous system in and around your gut. That's where our thoughts should be. Well, it turns out when you have small intestinal bacterial overgrowth, you don't have balanced bacteria in your gut, and dopamine, which is the chemical that is produced by our nervous system that actually helps stimulate motility of our bowels, as well as serotonin, both of these are produced by the bacteria in the gut, the healthy bacteria in the gut. And when you have an overgrowth in the small intestine, you don't have adequate quantities of your beneficial bacteria. You have too many of the wrong type of bacteria in there. So number 3 on the list is your bowel motility is not consistent and is abnormal in some way. And that leads us into number 4, which is that your RLS symptoms seem to wax and wane, meaning that they have periods of sometimes they're better, sometimes they're worse. If that's the presentation that you see, you need to consider that this may not only be a nerve issue for you, there may be a gut connection here as well. So severity often gets worse when we look at SIBO, but then it starts to improve. So SIBO goes through the same pattern of waxing and waning. It'll be better for a little while, and then your symptoms will flare up. It'll seem like it's good for a bit, and then out of nowhere, it seems like your symptoms start to return. If your RLS is presenting that way, you probably need to be thinking that I've got a gut component here that I need to start to deal with. And also, if you've ever used antibiotics or any type of antimicrobial herbal, meaning an herbal that is intended to inhibit the growth of problematic bacteria or fungus or parasites, and you notice that when you were taking that you also saw an improvement in your restless leg syndrome, that's a clue, guys. That is a connection that you need to make, and it's telling you you need to do more work on your gut and that you probably have small intestinal bacterial overgrowth that needs to be brought under control. Now, let's get into the last one here, which is number 5, and is that if you have, along with your restless leg syndrome, an accompanying lack of motivation, you don't have good coordination, you sit down to do things and you can't stay focused, your concentration feels like it's all over the place. Well, remember, restless leg syndrome is linked to dopamine. I talked about how dopamine was tied in with the bacteria in your gut and that they produce dopamine. Well, if you're dealing with a lack of motivation, coordination, and or focus and concentration problems, there's a problem with your dopamine. And so dopamine, if you just think about how dopamine functions in the body, it's our motivation chemical. It's produced in the front part of our brain. It's what we classify and think about as part of our reward system. So when you do something and you feel better about it or it gives you a positive feeling, well, you just triggered your reward system in the brain, but you got a dopamine response. In fact, many people use that terminology now of a dopamine hit when you take when you do something that makes you feel good temporarily. But again, what's important here is that the bacteria in the gut, they produce dopamine. And so when they have low production, you're going to see dopamine deficiency symptoms that are much more prevalent. And your RLS, your restless leg syndrome, well, it's going to be much more active. So that's 5 clues for you that you need to be looking at your gut. So how many of these five clues can you relate to? Well, if even one of them resonated with you, then you are going to want to know more about small intestinal bacterial overgrowth, aka SIBO. So let me help you out. The video on the screen right now is going to tell you what small intestinal bacterial overgrowth is and how to get started.